Staff, April 11, 2020. Spain officially recommends face mask use. Gazette Life. Retrieved April 20, 2020. MW parser output citation font style inherit. MW parser output. Citation Q quotes. .mw parser output. ID lock free a .mw parser output. Citation. CS1 lock free a background image URL /upload.wikimedia.org/wikipedias/commons/thumb/6/655/lockgreen.svg.9px/lockgreen.svg.png background image linear gradient transparent URL /upload.wikimedia.org/wikipedia/commons/6/65/lockgreen.svg background repeat no repeat background size 9px background position right 1m center MW parser output ID lock limited a .mw parser output ID lock registration a .mw parser output citation CS1 lock limited a .mw parser output citation CS1 lock registration a background image URL /upload.wikimedia.org/wikipedias/commons/d/d6/lock gray alt2.svg/9px/lock gray alt2.svg.png background image linear gradient transparent URL /upload.wikimedia.org/wikipedia/commons/d/d6/lock gray alt2.svg background repeat no repeat background size 9px background position right 1m center MW parser output ID lock subscription a .mw parser output citation CS1 lock subscription a background image URL /upload.wikimedia.org/wikipedia/commons/thumb/aaa/lock red alt2.svg/9px/lock red alt2.svg.png background image linear gradient transparent URL /upload.wikimedia.org/wikipedia/commons/aaa/lock red alt2.svg background repeat no repeat background size 9px background position right 1m center MW parser output CS1 subscription .mw parser output CS1 registration color number 555 MW parser output CS1 subscription span .mw parser output CS1 registration span border bottom :1px dotted cursor help MW parser output CS1WS icon a background image URL /upload.wikimedia.org/wikipedia/commons/thumb/4/4c/wikisource logo.svg/12px wikisource logo.svg.png background image linear gradient transparent URL /upload.wikimedia.org/wikipedia/commons/4/4c/wikisource logo.svg background repeat no repeat background size 12px background position right 1m center MW parser output code.cs1 code color inherit background inherit border inherit padding inherit MW parser output CS1 hidden error display none font size 100% MW parser output CS1 visible error font size 100% MW parser output CS1 main display none color #33AW33 margin left :0.3m MW parser output CS1 subscription .mw parser output CS1 registration .mw parser output CS1 format font size 95% MW parser output CS1 kern left .mw parser output CS1 kern WL left padding left :0.2m MW parser output CS1 kern right .mw parser output CS1 kern WL right padding right :0.2m MW parser output citation MW self-link font weight inherit Coronavirus disease 2019 COVID-19 is an infectious disease caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. 8. The disease was first identified in December 2019 in Wuhan, the capital of China's Hubei province, and has since spread globally, resulting in the ongoing 2019-20 coronavirus pandemic. 9-10. Common symptoms include fever, cough, and shortness of breath. 5. Other symptoms may include fatigue, muscle pain, diarrhea, sore throat, loss of smell, and abdominal pain. 5-11-12. The time from exposure to onset of symptoms is typically around 5 days but may range from 2 to 14 days. 5-13. While the majority of cases result in mild symptoms, some progress to viral pneumonia and multi-organ failure. 9-14. As of April 20, 2020, update, more than 2.41 million cases have been reported across 185 countries and territories, 15, resulting in more than 165,000 deaths. More than 632,000 people have recovered. 7. The virus is primarily spread between people during close contact, a. often via small droplets produced by coughing, b. sneezing, or talking. 6-16-18. While these droplets are produced when breathing out, they usually fall to the ground or onto surfaces rather than remain in the air over long distances. 6-19-20. People may also become infected by touching a contaminated surface and then touching their eyes, nose, or mouth. 6-16. The virus can survive on surfaces for up to 72 hours. 21. It is most contagious during the first 3 days after the onset of symptoms, although spread may be possible before symptoms appear and in later stages of the disease. 22. The standard method of diagnosis is by real-time reverse transcription polymerase chain reaction, RRT-PCR, from a nasopharyngeal swab. 23. Chest CT imaging may also be helpful for diagnosis in individuals where there is a high suspicion of infection based on symptoms and risk factors, however, it is not recommended for routine screening. 24-25. Recommended measures to prevent infection include frequent hand washing, maintaining physical distance from others, especially from those with symptoms, covering coughs and sneezes with a tissue or inner elbow, and keeping unwashed hands away from the face. 26-27. The use of masks is recommended for those who suspect they have the virus and their caregivers. 28. Recommendations for mask use by the general public vary, with some authorities recommending against their use, some recommending their use, and others requiring their use. 29-30-31. Currently, there is no vaccine or specific antiviral treatment for COVID-19. 6. Management involves treatment of symptoms, supportive care, isolation, and experimental measures. 32. The World Health Organization, WHO, declared the 2019-20 coronavirus outbreak a public health emergency of international concern, FIEC 3334, on January 30, 2020 and a pandemic on March 11, 2020. 10. Local transmission of the disease has been recorded in most countries across all 6 WHO regions. 35. Those infected with the virus may be asymptomatic or develop flu-like symptoms such as fever, cough, fatigue, and shortness of breath. 5-38-39. Emergency symptoms include difficulty breathing, persistent chest pain or pressure, confusion, difficulty waking, and bluish face or lips. Immediate medical attention is advised if these symptoms are present. 5. Less commonly, upper respiratory symptoms such as sneezing, runny nose or sore throat may be seen. Gastrointestinal symptoms such as nausea, vomiting and diarrhea have been observed in varying percentages. 40-41-42. Some cases in China initially presented only with chest tightness and palpitations. 43. In one study, only about half of patients had fever at the beginning of their hospitalization, but 89% developed fever at some point during their hospitalization. Fever and respiratory problems appeared later both for some older persons and for some persons with other medical conditions. 4. In some, the disease may progress to pneumonia, multi-organ failure, and death. 9-14. In those who develop severe symptoms, time from symptom onset to needing mechanical ventilation is typically 8 days. 4. Loss of smell was identified as a common symptom of COVID-19 in March 2020, 1237, although perhaps not as common as initially reported. 36. As is common with infections, There is a delay between the moment when a person is infected with the virus and the time when they develop symptoms. This is called the incubation period. The incubation period for COVID-19 is typically 5 to 6 days but may range from 2 to 14 days. 97.5% of people who develop symptoms will do so within 11.5 days of infection. 46. Reports indicate that not all who are infected develop symptoms. The role of these asymptomatic carriers in transmission is not yet fully known. 47. However, preliminary evidence suggests that they may contribute to the spread of the disease. 48-49. The proportion of infected people who do not display symptoms is currently unknown and being studied, with the Korea Centers for Disease Control and Prevention, KCDC, reporting that 20% of all confirmed cases remained asymptomatic during their hospital stay. 49-50. China's National Health Commission began including asymptomatic cases in its daily cases on 1 April. Of the 166 infections on that day, 130, 78%, were asymptomatic at the time of testing. 51. Serious symptoms include difficulty breathing, bluish lips or face, persistent chest pain or pressure, confusion, and an inability to arouse. 52.